Thanks for having me at your pre-pharmacy club meeting. My name is Bhakta, and I'm an associate professor at Roseman University of Health Sciences. So excited to talk to you about pharmacy and maybe a little bit about Roseman as well. So hopefully after my presentation today, you'll get a little more information on what's required to go to pharmacy school and be a pharmacist, as well as maybe think about and learn about some areas that are not as well known out there, and think about where pharmacists can work, and then maybe a little bit of specific information on how to become a pharmacist more at Roseman University, but I can try to answer questions about any program because some of them do have a lot in common. This is just my bio and my title here at Roseman University. So my training involved maybe something that some of you have done. I went to undergraduate college at the University of California, Riverside. I ended up getting a bachelor's of science degree in chemistry there. And then I went to pharmacy school, if you go to the right, at University of the Pacific. It's located in Northern California, and it was a 3-year program. And I actually opted, it is optional to do additional training. So I did additional training at a Veterans Affairs hospital in Long Beach, California. And that really allowed me to get a bit more experience and be competitive for a job in teaching in the College of Pharmacy like I do now, or working in a hospital, in which I did before I took this current position. My kind of job right now is a little bit different than what it was when I started. As I mentioned, I am an associate professor, and I do kind of specialize in cardiology. So a lot of my teaching in the classroom revolves around cardiology topics. I'm joining you from my office at the hospital, St. Rose Dominican Hospital, and I also work with the Department of Cardiology here at my hospital, basically to kind of teach pharmacy students a little bit about what pharmacists can do in a hospital, specifically in a cardiology setting. And pharmacists can be involved in many different things in a hospital, but my focus is really to evaluate what medications a patient is taking while they're in the hospital and figure out, could any of these be causing a problem they're having now, or are they missing a therapy that they should be on based on their current medical conditions, mainly cardiac medical conditions. So it does sound a little bit like I do quite a few different things, and I would say that that's probably true. Every day is different than the day before. So a typical day for me really revolves around 2 different locations. As I mentioned, I'm joining you from my office at the hospital. So I sometimes go to the hospital first and work with nurses and physicians, patients. Sometimes we have residents, medical residents or pharmacy residents, as well as my students who are in their final year of pharmacy school. Here at Roseman, that would be their 3rd year. And I really kind of try to expose them to different skills or different tasks that pharmacists would participate in or be responsible for in a hospital setting. So sometimes it is a little bit all over the place. So what kinds of things might you think about when you consider pharmacy as a career? Within the healthcare professions, pharmacy is considered one of the most trusted professions. I think one of the reasons for that might be because about 90% of people in the United States live within 5 miles of a pharmacy. So that really makes pharmacists very accessible, and people, if they see you, then they may perceive that you are more trustworthy as well as being more accessible. So that's really good if your goal is to kind of help patients or help people with medical conditions. This is a QR code. I have it again at the end. If you want to scan it, it takes you to this really cool website called pharmacyforme.org. they have different questionnaires on there, and you can kind of answer them to see maybe this is something I want to do, or is pharmacy something that I might be suited for. I'm going to pause sharing this screen, and I created a Kahoot. I'm hoping some of you have your phones out since I can't see you. But let's see if we can play this Kahoot together, just so I can kind of try to get to know you a little bit and see what your interests might be, or if they align with pharmacy. So this is, you've probably done this before. And so there's going to be a QR code that you can scan, or this, if you go to a Kahoot app or kahoot.it, you can put in this game pin. So I might just wait. If you're having issues, you can unmute and let me know, or you can put something in the chat and I'll be happy to try to respond. Great, thanks, Chandra. Some of the fun is the volume. So we do use Kahoot quite a bit at Roseman for different classroom kind of things. So it makes it kind of fun. I'll wait just another 10 seconds or so to see if anyone else wants to join. Otherwise, we're going to get to know a lot about Reagan and Chandra. If anyone else wants to join after I start, then feel free. These are just polling questions, so kind of get to know you a little bit. Okay, so everyone's from the United States. Awesome. I'm from also born here in the United States. I actually was born in Nevada, which is where I currently am. Sorry, I was actually born in California, San Francisco. I don't know why I said that, but I grew up in Nevada. My parents moved to Nevada when I was very young. And so that's kind of my background. Let's go to the next question. If you want to join, the game pin is at the bottom. Okay, we got burgers. All right. Oh, some sushi and pizza. I would say all of the above for me. I also would pick tacos. There's a lot of folks who are foodies here in the Las Vegas area. Lots of really great restaurants and places to try different kinds of food. So if consider yourself a foodie or into food, then Las Vegas is a pretty great place to try all kinds of different things here. Okay. Oh, yes, Barbie. I've kind of watched all of these. That's what I kind of picked up. But a lot of good ones, a lot of good movies out there, and I do enjoy going to movies. Hopefully, you all do as well. Oh, I didn't think anyone would pick elephant, so that's exciting that somebody did. We got a couple cat folks, and then I would probably have said dog. I was gonna share a picture of my dog, but I thought that would be extremely obnoxious, so I won't do that. But I mean, all animals are pretty great, I would say. Last one. Okay, interpreting scientific literature. Some of you want to improve on that, and then managing difficult situations. Thank you for answering those. I would say all four of these skills are skills that our students can improve upon while they are in pharmacy school. But all of these, you have the opportunity to get better in if you go to pharmacy school. Okay, well, thanks for participating. I'm going to go back to the slide presentation. Okay. So this QR code will show up again a little bit later, or if you just go to the website, pharmacyforme.org, you can take different quizzes to kind of see if pharmacy is right for you, or just learn more about the profession. So I'm not going to go into every single one of these areas, but these are different areas within pharmacy that people who graduate from pharmacy school can kind of go into. So they're kind of broken up into different areas. Some of them, like me, involve patient care. Maybe some people would consider that we are experts on medications. Some people go into population health. So if you're interested in public health or making a difference on a wider scale for patients, some pharmacists work within insurance companies or within the healthcare system to try to address different health issues in a group of people. There's management. I have a boss, my boss has a boss. And so those people are also pharmacists. And then pharmacy informatics, which just like everything, every profession, if you know a little bit about computers or coding and you enjoy that, that's also an area within pharmacy that you can pursue. So let's take a look at some of these a little bit closer. And if you have questions, feel free to drop them in the chat or unmute yourself and ask, and I'll be happy to try to answer them. So pharmacists who work in patient care, a lot of you might be thinking of the more traditional role of pharmacists in a community pharmacy. I'm not 100% sure which grocery store or chain stores there are, but probably Walgreens or Save-On or Kroger, any of those would be considered community pharmacies. And then there's hospitals, and then there's also clinics where pharmacists can work. And they can work to collect information. Sometimes that means collecting information by interviewing people or looking in the medical record and assessing what health issues they have and how we can help optimize their medications to best treat their medical conditions. We work with other healthcare professionals like doctors, nurse practitioners, physician's assistants, nurses, to come up with a treatment plan and figure out how to monitor the medications in people. You may have gotten a vaccine from a pharmacist. So most community pharmacies, I know the laws are different across the United States. So I'm primarily speaking about the laws here in Nevada and Utah, where pharmacists are allowed to administer immunizations or check blood glucose levels or monitor for blood pressure, different wellness services. And then more and more pharmacists are starting to get paid for the time they spend on educating patients or counseling them. So that's kind of really exciting if you're really interested in getting involved with patient care. Next, we're going to go to pharmacists as medication experts or working in population health. So some of these words might be a little bit new to you, but pharmacokinetics and pharmacodynamics is kind of the study of how a medication works in the body and affects the body. So pharmacists can get involved with different drug companies to study the effects of medications. There's also something called pharmacogenomics. Even though there might be two people who both have the same ethnicity or race, the medication may not work the same based on their own genes and how their genes interact with the medication, like metabolize the medicine or eliminate the medicine. So there are pharmacists who will genotype patients, and we can kind of guess what a medication is going to do based on somebody's genotype, which is really kind of cool. And then antibiotics, there's a lot of stuff in the news about the overuse of antibiotics. And so there are pharmacists who work in something called antibiotic stewardship to try to streamline the use of antibiotics in the patients that they take care of. So all kinds of things that pharmacists can do in those different areas. And then, of course, there's pharmacists as managers. Sometimes managers develop policies or procedures or protocols. A pharmacy has to have medication. So somebody's in charge of our inventory, what happens if there's a disaster, setting up contracts with different people. And a manager can be in just about any area where there is a pharmacy. Sometimes the managers or bosses are involved in finding the most affordable medication options. So they work with insurance companies and hospitals and different health systems. And then managers are also involved in teaching and supervising students and other pharmacists. So if you've ever had a job and had like a boss, that person in a pharmacy is also a pharmacist. So it's kind of nice because they can relate to what their employees are going through. A little bit about pharmacists in the information technology or informatics area. I don't know if any of you have been in a hospital or have worked in a clinic of any kind, but now with the Affordable Care Act, one of the requirements was that all healthcare settings have to have an electronic medical record. All of the patient's medical records have to be electronically available as opposed to paper. As a whole, that rule has really made us a lot more efficient because we can all be looking at the patient's information at the same time. I started pharmacy school a very long time ago. So back then we just had paper records. So we had to wait until one person was done before I could access it. The next person would have to wait until I was done, etc. So pharmacists can be involved in managing the electronic medical records or working for a company that designs the electronic medical record. There's also research that gets done using medical records and the information from those. That would be like a pharmacy, applications analyst. And so there's all kinds of things within informatics that pharmacists can do. Most people that I know who work in informatics, they have a strong interest in technology, and they did have some training with coding or learning different languages, so that there is more training required outside of pharmacy school. But if it's something that you're interested in, there are quite a few options out there. And then this kind of relates to the Kahoot question I asked. There's different skills that everyone learns when they go to pharmacy school, and we work on them as we go after we finish pharmacy school. Those include clear communication. Most people, you kind of have to have an empathetic or caring nature before you start, but we try to help you get a little bit better at that. Excuse me. We all work on our professionalism and how we maintain composure in difficult situations. A lot of pharmacy school students will tell you that they study all the time. It does feel like you study all the time because you're trying to get a lot of knowledge during those years. And most of our most successful pharmacists are very motivated. Sorry, got something stuck in my throat there. So let me talk to you a little bit about Roseman. And I don't have too many more slides left, but I'll give you a little overview of Roseman University. We do have two campuses. As I mentioned, I'm in Southern Nevada, right outside of Las Vegas. So I'm on the Nevada campus, but we do have a campus outside of Salt Lake City. I would say the mountains in Nevada are very pretty, but we're a very desert landscape. So the picture of the South Jordan campus is very pretty with the snow-capped mountains in the background. It's even prettier in person. But Henderson has its own unique beauty, desert beauty. A few things that make Roseman unique compared to other colleges of pharmacy. There are other, so we are a 3-year program, and there are also 4-year programs out there. The reason why we're a 3-year program is not because you learn less, it's that there are fewer breaks compared to a traditional 4-year college of pharmacy program. So most 4-year programs, they do take a summer break over a few months, and their spring break and winter breaks are a bit longer. We do take a winter break for 2 weeks. The spring break is a couple of days, and the summer break, there isn't much of one. So that's why we're able to finish everything in 3 years. Another unique feature of Roseman University is the way that students learn. So I'm going to direct your attention over here. I don't know if you can see my arrow to the top right where it says block curriculum. So at your college, if you've ever taken summer session, you probably did block curriculum, you just didn't know it. That's basically where you take like one class at a time. And for me, it was analytical chemistry. So analytical chemistry, I took just in the summer over 5 weeks, but I had to go to class every day for analytical chemistry. And in between there was a midterm and a final. So Roseman is similar in that way. At one time, students are learning one subject, but so the plus side is you're just focusing on one thing. The downside is because everything is going so fast, if you miss a day, it's kind of a lot that you miss. It's like missing a week or a week and a half of information. So most students at Roseman have excellent time management skills. Another really unique thing we do is the students are actually in class from 8 a.m. to 3 p.m. every day. And you must be thinking, that's a long time to sit around and listen to somebody. The good news for you is that you're not sitting around listening to someone the whole time. We do something called active learning or collaborative learning. So I'll give you an example. When I am in the classroom, I might lecture for about an hour to an hour and a half, and then we do a bunch of maybe Kahoot or maybe a different type of interactive learning where I give a scenario or I give a problem, and the students have to work in a group or individually to solve that problem. And usually they have to use the information that I lectured on to solve the problem. So it's a way to incorporate something that you've just learned into a real life scenario. Another really unique thing about Roseman is that the way this diagram shows the gray hexagons, that's where all the students sit. So the students sit kind of all around, and myself as the professor, I'm in the middle. So I have a lecture podium in the middle, and then there's screens above my head that face each hexagon. And so we're all kind of looking at each other. So everyone's kind of on the same level, and that's why we use classroom as a teacher, as a way to interact and teach information to students. So it's really, I've taught elsewhere before, and this is a very unique model. And I can answer any questions that you have about this after now or at the end. A little bit about student life. As you know, the pharmacy school being 3 years means that things are very busy, but the only people who know what you're going through are your classmates. So one other very unique thing about Roseman University, so in order to pass an exam, students have to get 90% or better. But that is not that's not curved. So these students are not competing against each other to get that 90%. It's just 90%, you're competing against yourself. So there is a lot of camaraderie, and there's just a really good group environment at Roseman because our students aren't competing against each other. They're all trying to learn the material, and the bar has been set at 90%, and everyone's just trying to meet that bar. They're not trying to push other people out of the way to get to that bar, which is really kind of cool for our environment and just for the camaraderie. I can't think of a different word right now. We do have a lot of student organizations. Our students do a lot in the community. They help interview patients at senior care centers. Las Vegas there's a lot of people who retire here, so we tend to have a high senior population. We do drug take-back events. Those are events in conjunction with the Las Vegas Police Department in collecting expired medications or any medications or drugs, and then we dispose of them in a safe manner. We also have a Medicare call center where people in Nevada can call our number and our students answer the phone, and they get trained on how to guide people into picking the right Medicare plan for them or answering questions about that. And our students administer vaccines all throughout Southern Nevada. They also compete in different state and national competitions. And then, of course, they try to have a good time by doing fun things together, let off a little steam. So some of the requirements to go to pharmacy school, this is any pharmacy school, but I'm focusing on Roseman. High school, which you've already kind of completed, college, which you're in the process of completing. And then usually in your last year of college, you apply for pharmacy school, or you don't have to have a degree. Once you've met the prerequisites or completed the prerequisites, you would apply to pharmacy school. And Roseman is a 3-year program. And that I mentioned, I did some additional postgraduate training at the Veterans Hospital in Long Beach. You don't have to do that, but if you want to, that's an optional training that students can participate in. That's all I have prepared. This is the same QR code that I showed you earlier. It's going to take you to pharmacyfunding.org. And so I can leave it up here. I don't really have anything else, but I did want to open it up to any questions that you might have. Thanks for your time. Any questions from me in the chat or anything?
I had a quick question.
Sure.
So when you were an undergraduate, was there a specific experience that you had that kind of pushed you towards pharmacy, or like, I don't know, that you found really invaluable when it came to pursuing pharmacy?
I'm going to turn my volume up slightly. I think, please correct me if I'm wrong. I'm not 100%. I heard you clearly, but I think you were asking, as an undergrad, was there an experience I had that was valuable?
Yes, that's what I asked. Sorry, I'm in a really loud place right now.
Oh, it's okay.
But yeah, were there any experiences that you kind of found invaluable in terms of like pursuing pharmacy, and that maybe you still refer to? Sorry.
Yeah, no, that is such a good question. I wish I could pinpoint something. It may surprise you to know that I actually never walked into a pharmacy before applying to pharmacy school. Somebody, a family member, and then a professor from undergrad, I did pretty good in chemistry and biology. And so they were like, hey, have you ever considered pharmacy? And I was like, no. So then I looked into it a little bit and ended up applying. But I think some of the things I did as an undergrad that probably helped the most in starting pharmacy school wasn't necessarily any class that I took, but it really did help to have pretty good study skills. I will admit I didn't always plan ahead of time, like for the midterm and the final, and sometimes I would cram. But that's not the best strategy going into pharmacy school, because a lot of the stuff that you learn in pharmacy school, you're going to use it over your entire career. So sometimes when we cram stuff, we remember a lot for a little bit of time, but in pharmacy school, we want to try to remember a lot of information for a long period of time. So having good study skills, like time management study skills, trying to keep on top of the material, especially at Roseman, because every day is so much material in order to get done in 3 years. So I would say as an undergrad, if you can try to figure out the best way you study, and figure out a way that keeps you motivated, and disciplined to study every day, that's probably going to be pretty invaluable, no matter where you go to pharmacy school, but particularly at Roseman. I think that was Karen that asked that question. Thank you, Karen. Um, the other question that was in the chat was kind of what led me towards cardiology. I also wish I had a really grand answer for this one, but when I started working as a pharmacist, I worked at a pretty large hospital. And so I worked in a lot of different areas. And then my boss or my manager asked the group of pharmacists, hey, we have an opening in cardiology. Does anyone want to apply for it? And so I went ahead and applied for it because I was looking to do something at that hospital that was more consistent. Like I didn't want to go to a lot of different areas. So then I ended up going for the cardiology spot and got it and ended up really liking it. And then I just, when I left that facility and institution to come to Roseman, there just happened to be a spot opening cardiology here too. So I guess it was just kind of meant to be all the way back then. The other question is, what do I enjoy the most about being a pharmacist? Oh man, that's a tough one. I mean, let's be real, work is work, so it's not going to fulfill everything. You have to have a good work-life balance. So I would say that's one thing that pharmacy does allow me is when I'm working, but then I am allowed to take time off and step away and rejuvenate, so that I come back to work motivated to do the best that I can. But probably what I enjoy the most about being a pharmacist is that what I do now, I never would have thought I could even do this as a job when I was in pharmacy school. So the profession changes, the pharmacist's responsibilities change every, I don't know, I'm going to guess 4 to 7 years. Right now, I don't know how much you all know about the different laws out there, but right now, the national pharmacy organizations are really trying to get our Senate and House of Representatives to pass a law, which a lot of people support in the federal government, in order to recognize pharmacists as a provider. So that would allow us to do a little bit more as far as interacting with patients, ordering certain lab values, starting or adjusting their medications and medication regimens. So that I think would be really great. We've been working on it for over 10 years, but that's definitely going to change the game. I don't know. I did look up where your university is. It seems like a pretty suburban or urban area, but I know Georgia is a little bit like Nevada in that there are a lot of rural areas where in Nevada, there are places where there's not even a doctor, but there is a pharmacist. So in Nevada, there are certain areas where pharmacists can do a little bit more just because they might be one of the only trained healthcare providers in that area. So what I like the most about being a pharmacist is that things change every day. So I feel, not every day, but every few years. So I feel like right when I'm like, oh, I don't want to do this anymore, something new comes along and I get to learn more about it. So I like that I don't, that I get to learn new skills and learn new information pretty regularly and then put all of that into practice. Um, I don't have anything else for the presentation today. So if you all don't have any questions, then I appreciate your time, and please check out our website or reach out. I believe Chandra has my email address. So if you all have any questions, oh, one more question. Is there any advice you have for undergrads preparing for pharmacy school that you would have liked to know? Ooh, that's another great question. I think when I started, what I would have liked to know is expect to I don't know how to say this. I'm trying to think of like a coach quote, that's why I use the basketball theme. I'm really into sports, but I wish I would have known that it's like for me, high school was great, but I didn't necessarily have to, I wasn't like hustling all the time and working hard throughout the whole 4 years. Undergrad, there were definitely some classes that were more challenging. I think we can all relate to organic chemistry, but every single class, every single semester was not like I was working hard. So I wish I would have known before starting pharmacy school that I'm probably not going to be successful every time I try to do something, but keep at it, keep practicing, ask for help, and eventually I'll get it. But kind of the first time I got a bad grade or didn't pass something, I definitely got down a bit. And so you kind of have to, I would say, if you can work on being mentally resilient and balanced, that would probably be the best thing that you could work on. I can't say a specific class that I took or anything like that, but I wish I would have had some of those skills before starting pharmacy school, because I think my emotions would have been a little more even when I wasn't successful, or like if I wanted a particular job and didn't get it, or a particular position and didn't get it. Um, I wish I would have, been a little more stable emotionally about those things. So I'll stay on for another 30 seconds or so if you all have any questions. Otherwise, I really do appreciate your time. Thanks.